Hey there. I'm really glad you're here in the Sink and Swim podcast. Before we get into today's episode, a little housekeeping. I want to help you get oriented just so you know where you are, how the space works, and how to take care of yourself while you're listening. So first, a gentle invitation. As you listen or watch, see if you can listen not only with your ears or watch with your eyes, but also by noticing what's going on inside your body. And that may change throughout the whole episode. And as you notice, permission to know you don't need to fix anything, you don't need to analyze it, but just notice it. Some parts of you might feel seen. Some might feel exposed. Some parts might feel resistance or concern about what we're saying. Other parts might feel relief, encouragement, or they might want to reach through and help us or hug me if it's just me talking. So notice how you feel as you settle in, whether you're listening in a quiet place or out on a walk or driving or in the middle of something, and also how you feel when you're done. That noticing is a really sacred work. And after you listen to the episode and notice, if you find yourself feeling the tug to stay connected to me or to the podcast or to any of my guests, please make sure to check the show notes and also make sure to subscribe to the podcast wherever you're listening right now. Now is a great time to go hit that subscribe button. And I'm not asking that for numbers, but because it lets the episodes find you without you having to remember or keep track. And if you like having something you can read or revisit or sit with more slowly, you can also subscribe to my newsletter, and that's in the show notes as well. You can also find clips and highlights on YouTube, Instagram, LinkedIn, Substack, and Facebook. All different platforms, different doorways to the same house. So choose whatever feels easiest for you. At any point today, later, or months from now, if something in you starts whispering, I feel this nudge inside. My life or my work looks really good on paper. Everything I've built should feel good, but that's not how I feel. And sometimes that can be a sign that it's time for deeper support and reorientation. And that's where working with me in a soul story mapping session comes in. It's a private one-on-one session, not a discovery call, not a sales conversation. It's an actual coaching space to map what's true for you right now and get clear on what wants to shift. Even if you don't do anything with it, we're just going to map it out. All of the links to all of those things live in the show notes, so you don't have to hold any of this in your head, but I'm saying it now to orient you in case you're listening and something comes up and you want to know where to go next. Okay, let's drop into today's episode now. Hey everyone, welcome back to Sink and Swim. I am truly over the moon for today's guest, who is a physical therapist, an educator, a self-described lifelong student and lover of school, and a swimmer. She has been someone who I've had the pleasure of having in my life for, I'm losing track of time, 11 years. And I've had the privilege to walk alongside as a mentor, as a friend, as a colleague, and a fellow human who is a kindred spirit in so many forms of the term, which you will see. We know a lot about each other, but you will see in this episode, there are things we learn about each other we have in common. We're like, really? That too? Kari Lindegren, Dr. Kari Lindegren is an amazing human. She is a big picture dreamer who is also self-described as a lover of control, although we shifted that definition just a little bit today. She's moved across the United States more times than most people would volunteer for, which is surprising for someone who hates change. She has built her career around working with youth athletes, specifically adolescent female athletes, even more specifically adolescent female athletes with pelvic health concerns. And she's now giving herself permission to transition out of solely one-on-one patient care to do the thing that took her a long time to give her permission to do and step fully into educating other clinicians instead of straddling that world and the traditional clinical one at the same time. And she's kissed a lot of frogs in the process. She has ended up working in settings that she said she would never work in, but she found her way back to herself and to her calling and doing those things. It was such a beautiful story. And as I mentioned, she's a swimmer, which means she already speaks my language. We didn't actually get into swimming too much in this conversation, even though the name of the podcast is Sink and Swim. She and I talk about how swimming is the place growing up and in college where she felt she could be fully alive and be fully herself, and how sometimes her identity in the academic world lagged behind. And being surrounded by people who we talked about fire at the same horsepower, both intellectually and also athletically, and also just as humans who are curious about the psychological and emotional experience of other humans, is really important. And she's been chasing both the feeling of feeling safe in what she's doing, but also belonging to her people through multiple moves, through multiple job shifts, through now motherhood of 2 young girls, through her love of Disney, which has been a lifelong thing. And I'm so excited to share her story with you. There's so many good gems in here. There's parts that made me tear up. And I loved our discussion around what it truly means to do no harm as medical professionals. And I think it's something that if you are a medical professional, if you are not one, but you are a patient, it illuminates in such a kind and gentle way how sometimes we miss things as medical professionals from the most well-meaning of places, and how sometimes we accept things as patients that we don't have to accept. And I am here to tell you that you deserve better as a patient, and that may you be blessed by providers who see you as a full human, who reach to you and tend to your emotional experience as much as your medical and physical experience. And when they don't get it right, they're willing to grow and learn and do better for the next person or your next visit. So without any further ado, it is my honor to introduce Dr. Kari Lindegren. Welcome back to Sink and Swim, everyone. I'm so excited because we have an actual swimmer here with us today. Our second actual swimmer on the podcast that fits the name of the podcast. So that's why I'm excited. Welcome, Dr. Lindegren, to Sink and Swim.
Thanks so much for having me.
All right. So I've already introduced you. I could just talk about you and brag on you forever. But we're going to get right into it because as we were just talking before we got onto this, we have such a similar shared background. And we were talking about like the psychology and the emotional state of kids, teenagers, and how the medical world often does better with kids and teens than they do with adults. It's just part and parcel of pediatrics. But I want to go back to when you were in the shoes of being a tween or a teen, and what that experience was like for you, because, you know, I would probably guess that that might have shaped your interest in that area. Would you agree?
Yeah. That's a great question. I think just like, going back, I think like being a kid, I was allowed to be a kid and have fun. And I had people in my life, not everyone always, there's people who kind of shut that down. Like I remember I loved Disneyland. I got to college and people were like, Disneyland? Like what? But for the most part, the people I surrounded myself with, my family kind of encouraged playfulness and exploring and being a kid. And I look back fondly on that and I think I'm just a big proponent on letting kids be kids, and letting them, and really adults should still be kids in some ways too.
We're all just big kids. I know.
Yeah. So I think I just really enjoyed that part of my childhood and just feel like I could connect. I've always felt that way. I think even in my first job was teaching swim lessons. And I've always just been.
Me too.
And I remember in PT school, I was like, I don't know what I want to do. And somehow I always just end up back working with kids.
Mm-hmm.
And everything, like looking back, I'm like, oh yeah, like obviously, like every single job I've had has been with kids.
I know. Same.
I think I just can connect to that. Even looking at my own kids, I just find so much joy in looking at the world through their eyes and just seeing the awe and wonder and just the joy, the pure joy.
Just letting kids be kids. I feel like that's its own podcast. And also, I'm so grateful you had that experience as a kid and that you just are completely unapologetic of, Disneyland. What? Love it. I know you just went too.
Yeah, we did.
To Disneyland, right? Was that your girls' first trip to Disneyland?
No.
Wait, how old are they? Tell the world. I know how old they are.
So my oldest will be 4 in July, and then my youngest will be 2 in August.
Okay.
Yeah.
So 4 and 2, and
Yep.
they're frequent Disneyland.
I wouldn't say
Well, let me say
frequent,
again.
but they've
Yeah.
been a couple times. 2 of those times have lined up with conferences that have been. The first was
Oh,
a
perfect.
conference actually at the Disneyland Hotel.
Uh-huh.
So my husband used to work at Disneyland, fun fact. So he was like, well, we're coming with you. And CSM in February was at the Anaheim Convention Center. So
Wait, that was 2 months ago, 3 months ago.
yes. Yep.
I think it qualifies as frequent.
This year we've kind of made it a year, and yeah. Anyway,
Twice in 4 years of life is
yes.
also frequent
We're gonna take a little break, I think.
for most people.
Yeah.
There's nothing wrong.
No,
That's not judgy. That's like, yes, right? If
They
every
love it.
kid could have that
I
experience,
think too,
that's
it's
amazing.
like my oldest is all in the princess, like princess dresses, like dressing up all the time, accessorizing. So it's I don't know. I think we're both. That's not going to last forever, and
It's true.
let her.
You're right.
I don't know. Yeah.
Amazing.
I think we get more out of it than they do, but that's okay.
Isn't that allowed though?
It is. It is.
Yeah.
It absolutely
Yeah.
is.
I mean, again, we all need to embrace our inner kid to that point. Well, okay, growing up, you were allowed to be a kid. And I know that being on the swim team, especially college, was like a place where you really felt like you could be yourself. Contrast that with places you didn't feel like you could be yourself, like school.
Yeah, it's interesting. Like I always reflect back on it, and people, like my teachers, were always like, "You're so quiet, and like you're so like the perfect student." Like I would sit there and listen and dot my I's, cross my T's, do everything, that I was told. And then at home, like I remember at home, I'd just be, I wouldn't say wild, but just super energetic, had a lot of energy, running around, loud. And that was kind of how I was at school. Like I was almost allowed to get out of this image of perfection that I think and it's so interesting because I wonder how much of teachers then telling me that kind of became part of my school identity, of like, well, this is what I'm supposed to do in school. And it's interesting because like my mom always like, I love like, and I tell people I loved school. Like I would go back. Like
Yeah, me too.
I love school. I love like so, but I felt like I couldn't truly be myself even in college. I think it took until getting into PT school where I finally felt like my two identities kind of combined.
School and like a passion, for something.
Yeah.
For building something. Yeah.
And I wonder too how much of it is being around like-minded people or people where I share a common passion with. Right? Like swimming, we were all very passionate about that and had that in common. PT school, we all had that in common.
What was it like in like grade school, middle school, high school, being like the smart kid, the good student, like peer-wise, you know what I mean? Because swimming gave you something where you guys had a common passion and goal and mission, and so did PT school. But what about the growing up school experience?
It's interesting. Like I have one memory in 6th grade about like lying or fibbing what I got on an exam or like a quiz. Like I remember standing outside of the classroom and being like, and I don't even remember what I said, but I think I had gotten an A or I did well, and I just completely fibbed on
pretended like you didn't.
Pretended like I didn't. And I wonder if some of that was trying to fit in, especially if that's like middle school, things are starting to get awkward and wanting to fit in, and other people weren't doing well. And I think in high school, it got a little like I didn't feel like I don't remember ever being blatantly made fun of, but I just remember feeling uncomfortable and not like allowed to enjoy it, like, or not allowed to celebrate it, if that makes sense. And I think in high school because I was taking like AP classes. And so it was a lot of people were kind of we were kind of similar in that
drive,
way.
ambition. Yeah.
But I still remember like among my like swimming friends, like we went to different high schools and it wasn't being made fun of, but it was always like, oh, you're fine. Like, you're so smart. Like you're gonna, like it was almost like they were praising me, but I didn't take it as praise. Like it made me feel uncomfortable. And it was just like, I'm just doing my best. Like, I just like to learn. I'm just doing my best. Like, and I think it wasn't until college really where I actually struggled and like failed a class where and it was just like, oh my God, like there are brilliant people out there. And just taking like, what does learning actually mean? And why am I doing this?
So interesting. Bringing it back to middle school, first of all, that you can remember the exact situation. Oh, yeah. And you don't know what you said, but it's like in memory in your cells at this point that you lied or fibbed or downplayed or whatever it was. And as a sixth grader, 11 and 12 years old, it encoded as wrong. That's why you remember it.
Right.
You know what I mean? Like, that wasn't good, And it's just that moment. I remember my moment, seventh grade, purposely spelling a word wrong in the spelling bee. People wanting to cheat off me in seventh grade in exchange for friendship. I've talked to so many people who tend to be in the ambitious athlete, achiever, good student world who remember their moment. And I don't remember, I remember spelling the word wrong. I remember the moment of deciding to spell the word wrong and knowing it was wrong in terms of like not breaking a rule, but betraying myself and a calculated choice that young.
Yeah.
Man, that's insane. And also, then in high school, you saying like, oh, you're fine, you make good grades, almost as if it dismisses your feelings of inadequacy or stress or anxiety about a test coming up or whatever it is, or not fitting in, whatever it was about. Again, we don't remember exactly what it was about. I remember those moments. I don't remember exactly what it was about. I just remember feeling like I was seen for my grades and therefore people assumed I was okay.
Yeah.
Because I was quote unquote successful, So dehumanizing in a way.
Yeah. Of like, well, no, I still have emotions and I'm still like, there's like things I still struggle with. I'm not perfect, even though you're painting this picture of perfectionism.
Even though I look strong and I am doing well on my report card, it doesn't mean I don't have the same emotional experience of life as you. Man. Yeah. And then college, when you actually failed a class, same. Super humbling, first of all.
Organic chemistry, still.
Mine was general chem. But obviously it's humbling. And some people might look at that and say, oh, well, the person who was perfect and made all the good grades finally learned her lesson and learned what it's like to be everybody else. Yes. And what's sad about that to me is you were given permission to own your humiliation or humbling experience, right? Because you failed. But when you were succeeding, you weren't given permission to be a human, Gosh, our society teaches that lesson, don't they? Especially to successful girls.
How like there were plenty of times I didn't swim well. Like I had failures before. It wasn't like the first time I had failed or like, but it was just different. I feel like the school, like to your point, how people treat grades in school is different than other things.
Yeah. Yeah. And going back to what you said about letting a kid be a kid, I feel like some of that is letting a kid feel the big feels and be in the emotional experience of life, the goods, the bads, everything in between. And in some respects, your grades made you grow up really fast or hide that part of yourself, that wild, like, very active part of yourself that you did see at the pool, that you did, see once you got to college and you were surrounded by people, and PT school, and you were surrounded by people with the common mission.
Yeah.
With the common drive and ambition.
And it's interesting, I think, the way school cutoffs worked where I lived. It was, I think, a December or January cutoff, and I'm a November birthday. So I started kindergarten at 4, which, like, I look at my own daughter and I'm like, there's no, like, that's young. That's young.
Yeah.
And I did fine.
Right.
Like
you were a smart kid.
I did fine.
Yeah.
Right. But I went to your point. Like it is interesting. Like I was no longer allowed to just run and be all day. I was in a classroom fitting inside of a box kind of.
I don't remember who said it, but the quote, play is the work of childhood. I wish that was extended to play is the work of everyone. It's how we connect, whether we're telling stories, whether we're goofing off, whether we're imagining things, whether we're moving our bodies, that the playfulness never got washed away or expected to be dampened or quieted. So you could study or succeed or perform or whatever it is you had to do.
Yeah.
Yeah. Well, thankfully, you had the really beautiful experience academically in college and in grad school, being surrounded by people who ticked the same way, who had the same, what did someone say to me recently? Horsepower.
I like that.
The same horsepower. It's not like a car with a V8 engine is better than a 4-cylinder engine. They're different and they serve different purposes. But when you're surrounded by people who tick the same way and have the same horsepower, then you just get to be again, you know?
That's so
Okay.
true. Yeah.
Speaking of going to college and PT school, so you grew up in Southern California,
Yep.
went to college at NYU,
Yep.
then went to grad school at Emory. So we've gone Southern California, New York, Georgia.
Yeah. There was a
You're
year
like
in
hitting the
Boston
corners.
too.
A year in Boston, that's right. A gap year. You're hitting the corners of the US. Now you live in Bend, Oregon. You have literally hit the corners of the lower 48. You've moved a lot. And interestingly, something you've said before is you don't love change.
No, I hate change. Hate it.
Make sense of that for us.
I don't know. I think I was really fortunate as a kid that my parents were really purposeful in showing us, like, our vacations were very much like going and seeing other things outside of where we lived. And it was always different. And I think it really opened my eyes. Like, they really pushed us outside of our comfort zone. I hated it a lot of the time. But looking back on it, I think it opened my eyes to show me like how much is out there. And it kind of lit this like adventurous spirit inside of me and this like love to explore. And I know that exploring new things is good. And I grow a lot from it, even though it's really hard. But I still remember the summer before leaving for college, like I had already made my decision. I remember laying in bed and just being like, I don't want to do this. Like, I can't, I don't want to do this. And then in my head, like another voice being like, but you have to. Like, it was almost like this inner wisdom of like, this is what's good for you, even though I was scared out of my mind. And looking back, like, it was probably one of the greatest things that I could have done. And I grew so much as a person. Like I always say, I feel like I got more out of how to be a person out of college than any academics could have given me. And being in New York City was just an incredible experience. So I think that kind of just showed it. Then it gave me confidence. Like, you can do this. You can move somewhere, and it's hard. It is really hard. I've had some lows every time I move. But I think too, like, as I get older, and I feel like kids is one of the most humbling things. And it just showing like some of my personality traits too. But I think I told my husband after we had kids, I'm like, man, I really like control. And he's like, you're just now figuring this out? Like, yes. But I think that's part of why I don't like change is I like feeling in control. And I don't know, it might have been you who said this actually, but like in reality, we have no control over anything in life. And it's like this false belief that we can actually control things. And I've noticed in myself when I feel like I don't have any control over anything, that's when I start spiraling and looking for control. And so I think that is kind of the root of not wanting change or not liking change is I feel totally out of control. Like, I don't know what's happening, but going through it enough, I've just learned to like the beauties of change and everything I get out of it. And it's funny, my husband is the opposite. He loves change. So like he'll like want to change the couch. He's like, let's rearrange the couch. And I'm like, no.
I like it how it is. I know.
But it's just, there can be I've learned there's a lot of good that can come out of it. And I grow as a person and letting go. I'm slowly, every year, slowly learning to let go more and more and just kind of be, which is a work in progress.
I think there's something very real to the human desire for control. And it is true. We don't have control over anything. And I think there's some gray area here around like having yourself rooted where your feet are. You know what I mean? In any given day, in any given moment, in being present, in not losing an anchor point to home.
Like stability.
Stability, yeah, to a sense of safety, right? I think what we're actually looking for is safety, not control, right? And change is always going to threaten our sense of safety, right?
Yeah.
Like it's like sand falling through your fingers. And so I think it's valid. It's like, but we just need to, not to mince words or be pedantic, but it's like we almost need to say what it is we really want, which is to feel safe. And then it's like, well, okay, changing the couch. Actually, I feel the most safe with it there. And maybe that's valid. You know what I mean? Maybe it means you can see the kids across the room or you see the light coming in a way that just makes you feel alive. Because aliveness also gets to define safety.
Yeah.
If you feel the most alive with it there, then why would we change it? You know, I think it's valid. And What's so interesting is we just talked about playfulness and adventure and this sense of exploring. And you said when I can reframe it to I'm exploring new things, when I can lean into playfulness, it's like it brings in an inherent sense of safety and anchoring for you.
Yeah, definitely. Yeah.
It's like a different part of you takes over and it's like, oh yeah, okay, we actually like this. Yeah.
And it's hard. I mean, change is hard, right? Like every time you move, right? New friends, a new routine, everything's new, right? And that safety, I think that's a really great word of like feeling rooted and safe and what I know what to expect. That's another, I think it's like, I like to know what to expect and what's coming.
That's fair. I think that's really resourcing to your system.
When I don't know what's coming, it's like, what can I control to try to make me feel like I know what's coming?
It's like we can't know what's coming, and at the same time, you can make a pretty good educated guess. And it's like you want as educated of a hypothesis as possible.
Yeah.
So I still got to go through the grand experiment of living it, but
yeah. So I think every time there's change, it gets better and better. You know, like I'm able to get through that. I feel like the lows aren't as low. There's, change is hard no matter what. But I think I'm able to take a step back more and just appreciate the journey a little bit more.
Well, something you've done really nicely, I think. It's like you have to meet new people, but it's like you find your people or you follow your people. In your case, your parents are with you, like they move too. And then you find your people. And you mentioned that it's like, yeah, we have to make all new friends. And that's the other big heavy hitter human need is belonging. One reason we don't like to change is because we're going to lose our people and then we have to make new ones and we might not like them and they may not like us. And all the things you went through as that middle schooler who felt like she didn't belong. And it's like, are they going to like me for me?
Mm-hmm.
Am I going to have to shapeshift? How's this going to work?
Mm-hmm.
Yeah.
That's an interesting, like I remember driving out of Atlanta when I was moving to Cincinnati for my residency and
also Ohio.
And it was like one of these, I'm like, I feel like I belong. Like I have gotten more involved with the APTA association in Georgia. I feel like I have these opportunities, like I feel like I belong. I found my people. Like I feel like, but it was almost like this calling of I knew something else. I needed to go do something else too. But it's hard.
There's something so inherently brave about that because I've said this before, but we are wired more strongly for belonging than we are for our sort of like our life's calling or our individual identity. And yet the call is to have both in life, right? And oftentimes we sacrifice who we are or what we're doing or what we want to do so that we keep our people. And that can work for us and against us in all sorts of ways. But you felt that. That was like, but I have my people. I belong here. And yet there's something more for me. And that's so brave because you're literally saying to your unconscious nervous system, yes, I hear you. And we have to go do this. Just like your college thing.
Yeah. Yep.
Yeah, we got to do this.
Yeah.
And you have to also have a sense of safety, even though it feels unsafe to do that.
For sure.
Yeah. I love when people say courage doesn't feel like bravery. It feels like anxiety. Sometimes it's like you don't want to make yourself have panic attacks and get into that. And I've done that many times. But
I think it's like to that safety point, I think like looking back on it, I knew like if it didn't work out in Cincinnati, like I still had a home in Georgia. Like I still had people in Atlanta that would welcome me back, or even going to college. Like if it didn't work out, my family would still welcome me back. Like I still had that safety coming back if I needed to.
I feel like that is one of the most important ingredients of not where, but who do I anchor into when I go fly?
Yeah.
Who's holding me through it? Who can I go back to? What can I go back to? Like if it's an identity piece. For me, like going into coaching, for example, was I can always go back to PT. I don't want to, but I can always. And I would be okay there. Yeah. And people would welcome me, Yeah. Super important ingredient for anyone who's listening and you're kind of straddling that, like, should I stay or should I go? I think a thing people are missing is that who could I come back to or who's going to welcome me back if I need to?
It was like a backup plan.
Backup plan, your safety net. Yeah. Yeah. Jumping without a safety net's sometimes the way to go and sometimes not. Yeah. But maybe if you're someone whose system is just kind of oriented towards wanting a little more cozy safety, you know, and belonging, that's an important element to consider.
You might get to this going forward. I might be jumping the gun, but it reminds me of like when I left the first job I had when we moved back to Los Angeles, and I was scared out of my mind. And the biggest thing was not having the safety of a job. Like I wasn't married at the time. Like I was about to, like, I knew I needed to leave, but I didn't have a backup job. And I'm like, I really had these thoughts of like, I'm going to end up on the street. Like I'm going to have no job, you know, and in hindsight, like talking with people, you know, I had my people and I was walking through it and they're like, that's not going to happen. Like you have a safety net, you have people that will support you. Like, but it's scary. Like it's scary to be like, I have this comforting, I have a job that pays me decent and I'm just about to leave it with no backup plan and I have no idea what I'm going to do. Like, what am I thinking?
Yeah, I get that.
I think you were one of the people that I talked to. I'm like, what do I do?
I'm almost certain what I said. I'm like, I know exactly what I would have said then too, which is something to the tune of, okay, be honest with me though. Have you ever failed? Has it ever not worked out?
Right.
And you were probably like, yeah. It's like taking that achiever, right? And pointing out that, like, I get it. I'm with you. And you are, yeah, you failed a class, whatever, but that doesn't count because that you bounced back, right?
And it's like,
just, you had to hit a low point.
I think going back to the like high achieving, like everything was planned out. Like you go to school, you get good grades, and then I'm going to go to college. And then after that, you know, I had a gap year where I was trying to figure it out, but I knew I was going to grad school. Like I knew I was going to go do something. And so then I go to grad school. And then even after PT school, I had a residency lined up.
I know.
And then it was like everything just was planned. And like, I don't want to say it was laid out, but like it was there. And I didn't have to take too many risks in a way. Like, and then this leaving the job was just like, I'm going to throw my hands up in the air and I don't know like, I don't know what's going to happen. And it was the first time I feel like I truly didn't know where I was going.
Yeah. Well, it truly wasn't pre-written.
Right. Yeah.
In any way. It was truly your choice.
Yes.
And, you know, I mean, you had a partner at that point too.
Yes.
So it wasn't a solo choice, but it was still your true choice. Not that any of the other ones weren't, but I feel like
someone accepted
in the pre-written
someone
path,
hired me.
You had to apply, you had to, and same with even getting a job in LA, but I feel like you could have finished residency and gotten a job anywhere. And so you chose that. Mm-hmm. Yeah. That's daunting for someone who wants safety and belonging everywhere they go, which is everyone. But like it's like the volume in your system is just louder for that. It's like, I just really tick well when I have these things. And I don't think there's anything wrong with that. I don't think this is a problem. I think it's just knowing that about yourself.
Yeah.
Okay. So that job in LA, the very first job you got, did it go as planned?
No, absolutely not.
I both love and my heart hurts for this part of the story, but I'd love for you to share it because I feel like we're sitting here going, oh yeah, have you ever failed? Has it ever not worked out? Well, actually this one didn't work out. Right. And you're saying you have to hit low points. So tell us about that.
Yeah. So when I was in Cincinnati, so I did my residency at the Children's Hospital, and again, kids, stayed for a couple years and then wanted to move back closer to home. And I was looking for kind of a similar job that doesn't exist, you know, really in Los Angeles. So I was like, well, what are my, you know, I have my OCS, my orthopedic specialty certification. So I'm going to go do ortho. That's what I should do. And so I was like, well, I love, you know, sports. I'm going to look for like a sports clinic. So it was a kind of general orthopedic adult. I mean, we saw everyone from, you know, high school to 80s and 90s with a focus on sports, but it was really kind of just your general outpatient ortho. And it could have been a lot worse, to be honest. Like we were patients, from what I'm remembering, this was so long, I kind of blocked some of this out, but patients were scheduled every 30 minutes. So I was working 10-hour days and patients were scheduled every 30 minutes. So we weren't double booking this. Well, that's a lie. There were some moments where we double booked. And so even like previous to that, I was used to seeing, you know, some overlap in patients. And so I was like, it can't be that. Like in terms of volume, it's not much different, but it just rocked me. Like I don't know if it was well, I do know some of it was the patient that was when I had the realization I need to be with kids. It's like, I'm not the best suited for adults. I can do it.
Mm.
And I did fine, but it's just not where my heart is. And I think some of the culture, there were some things that I was being asked to do in terms of billing that I didn't feel comfortable with. And I think the best way I can put it is my personal values and my values as a PT just didn't match up and align with those of the clinic. The clinic, I don't think the clinic was necessarily doing anything illegal. There was nothing red flag, but it just was my values weren't aligning to the values of the clinic. And so there was just this mismatch that it became like my blood pressure actually was rising. Like I remember going to my like PCP for an annual and just being like I know my blood pressure, like I've tracked it over time. And I was like, oh gosh, like it was trending up. And I was just feeling more anxious, and like I would go home and cry. And it was actually my now husband, who I was dating at the time, who was like, every time you have a patient under the age of 16 as your last patient, you're a different person when you come home. And I was like, okay. And so I kind of got to the point where, and this is like, I feel like my worst nightmare as a PT is I was almost and I think some of it was the volume of patients and the way that they use aids, and what is legal in California is completely different than what's legal in Ohio. So I was having to let an aide do the exercises for my patient. And anyone who knows who has worked with me, like I love movement and I love fine tuning movement and paying attention to what my patients are doing. And so to just let someone else do it was so hard.
You're giving away the part that makes you feel alive.
Yeah, and so I was expected to just do the manual and then pass it off. And I just couldn't let go of that. And I just didn't feel like I was giving optimal care to my patients. And I kind of got into this routine. I noticed like I was treating every shoulder patient the same, which is awful. Like I was just like, this is not how I want to treat. This is not for me. I can't do this anymore.
I teared up when I imagined you going home and crying.
Yeah. But it was
also,
interesting.
I understand it.
Because
I've been there.
It was around, I hadn't left that job yet, but I was like, I had this calling. I was like, I need to be back with kids. And I know like the Children's Hospital in LA doesn't have like a separate. So in Cincinnati, there's a separate orthopedic sports clinic and then a separate developmental. But in LA, it's all kind of one. So I was like, well, I don't fit in there. But I kind of felt this calling, like, I'm like, I just need to be at a children's hospital. And I actually remember my interview. So I applied for a per diem job. I was just like, I just need to be back. I don't care what I do. I'll just, if they want weekends, I'll work extra. And I remember in the interview just saying, I just want to be back at a children's hospital. Like that is all, like, I need to be part of this. And so actually when I was hired, I was on acute care, which was like total, like I remember telling some of my mentors and they were like, what, but it was just, I felt more alive on acute care at a children's hospital than I did using my orthopedic knowledge that I did a residency for in the adult population. And so that's when I was just like, okay. And so
confirmed.
Yeah.
You belong with children.
Yes. Yeah.
Doesn't matter what the setting is at this point. Just get me back there.
Yeah.
What an honest thing to say in an interview, first of all. And secondly, what an honest read on like where your soul feels alive. Like so authentic and so real. And I've also had that moment. Oh my God.
I know.
I think we were talking like recently about, said I'd never do that setting. And here we are. I did it when leaving a job that was killing me and between sort of moving into the next thing. But it was the same thing. I was like, I worked at the children's hospital. I just know I need to be there. I'll take any setting at this point. I'll learn.
Yeah.
I'll work the weekends.
Yep.
I don't care. I just need to be there because I know it's going to be a good experience. And that's what matters to me more than the knowledge and the skill and,
it's funny
specifics.
Going back to your belonging, because I said this to one of my colleagues who, she's one of the core faculty where I help teach, and she leads the pediatric curriculum. And I just was like, Pete's people are just the best people. Like it was just this, I can't remember what she said, but it was something postpartum that she said to me. And it was like, you're my people. Like I don't know.
Okay. I want to pivot to this conversation right here, because we were talking about it before we got on live. But I think it's actually a really important piece of it's how we as providers, and I think what's really cool is you're building something to help educate providers on working with peds patients, right? Young athletes, adolescent pelvic health. And as both a provider and a patient who's gone through postpartum, who's gone through something completely identity shifting, completely traumatic to your body, tell me about your experience with adult medicine on the receiving end, but also on the observing end as a provider, right?
Mm-hmm.
Versus being, you might not remember being a pediatric patient, but being in pediatrics.
Mm-hmm.
And like, where do we get it right in pediatrics in terms of how we honor the patient's experience versus adult medicine? Because you're even kind of getting there with this outpatient setting where it's very like mechanistic and you're just kind of passing people off and there's not a lot of connection. You're not in your element. It's just not the same. What do you think about that?
It's interesting. As a patient, I feel like providers aren't necessarily thinking about what they're saying to me. It's just kind of just said, and then you can deal with the information however you need to deal with it. But I'm just going to, whereas we're much more, as providers working with kids, much more conscious, I think, of what we say and how we say it and how we approach it. And I think you brought it up, like, oh, maybe we need to bring child life in. We don't do it with adults. I think back to just even, my own birth experience of like giving birth, and the second time was phenomenal, but the first time, like, it was almost like I was told to do things and I didn't have a chance to say what I wanted. And in that moment, I was just wanting to be done, so I just gave in. Like, I just was like, okay, fine, whatever, but it's not truly what I wanted, and I wasn't able to stand up for myself. And I think now it doesn't happen all the time in pediatrics at all. There's still situations where this is not happening.
Totally.
But I think there's just more of we understand, I think, the vulnerabilities of children a little bit more, or we talk more about the vulnerabilities of children as opposed to adults who are supposed to be strong and resilient, and you're an adult and you can handle it kind of mindset.
What a parallel to the straight A student who grew up fast and wasn't allowed to have emotion. And it's like, I didn't even realize I was saying grew up fast, right? Like, you were treated as if you were an adult who had these not just advanced intellectual skills, but also processing skills emotionally when you didn't.
Yeah.
And it's like, why would you? And then in pediatrics, we just have an understanding in school, not just in healthcare, but in like, elementary school, there's just this acceptance. It's not perfect. We don't get it right all the time, that kids don't emotionally process the same way, don't cognitively process the same way. They may be brilliant by the book, but they're not necessarily emotionally brilliant. And this is an incredibly vulnerable time for them and their parents. Pediatrics does such a better job with parents and caregivers, right? Generally speaking. And yet it's like you hit 18 and all of a sudden we remove all of the humanizing elements, all of the parts of tending to the whole person and their vulnerabilities and their emotions. And even with our very best efforts, we miss the patient in front of us.
My favorite provider I've ever had was a male OB. And it was, I think, as when we work with kids, we're always told, get down on their level, right? Like, kneel down, make eye contact. But we don't really do that with adults as much. And he would come into the room for every visit and just sit in a stool. Like, I would be on the table, the exam table, and he would be below me and sit. And I never felt rushed. I never, he had a million patients. And I think often we do a better job not rushing with kids, or there's just more time given,
Both. Yeah. I think there's the provider's intention and energy, and then there's the environment too.
Yeah. Well, that too,
matters.
Like, I'm just thinking, like, being at a children's hospital too, there's much more effort, I feel like, on creating almost, they call them clinics, right? But it's, so a patient with something like spina bifida, for example, they go in and they're seeing orthopedics, they're seeing neurology, they're seeing a PT, they're seeing OT all in one visit.
Multidisciplinary.
And it's multidisciplinary. So now the family doesn't have to come multiple times. They just have to come once. It's a long appointment.
And all the hands are talking to each other.
Exactly.
Yeah.
And whereas an adult, it's just, okay, well, you're going to go here and then you're going to go there. And yeah. And I mean, you can talk to that way more than I can with your experiences, but it's just the medical system drives me nuts.
I'm the clinic. I am the one who puts it together. And so are most people. And, having a medical background is a double-edged sword in many ways. I'm so grateful I have the knowledge and the curiosity and the ability to do it for myself. And I hate it that I have to do it for myself, because I can see the whole thing. And I'm like, I should just be a patient. but I can't.
But those patients who
can't.
don't have that health literacy, and like those are the ones that fall through the cracks.
Or the ones that do too. Like you just posted on Instagram about this today.
Yeah.
I did a podcast episode about it a month ago about being the good patient and how I've killed her. She's dead now. Like, I don't want to be the good patient anymore. I don't want to be the good student. I don't want to be the good provider. It's like the patients without the health literacy fall through the cracks. And sometimes the ones with it fall through the cracks because you're seen as smart. Yep. Back to the straight A student who she must be fine. You're smart, you're accomplished, you speak the language. You must not have an emotional experience about it because you understand it. And you just had an experience about that. Very well meaning, nothing against the provider, but it was just like the mushroom cloud of this, or what's the word I'm looking for? Perfect storm. Yeah. That's the word. Yep. And I've had so many experiences about that, like umpteen, like so many, it's countless at this point. And I feel like there's a call. It's not, we call it trauma informed, be trauma informed. But the way that's taught in medicine is you have this picture of a person who might have quote unquote trauma, and even complex trauma like micro traumas. And there's sort of a symptomatology. There's a way we recognize them. There are screening forms, but but if someone doesn't fit those criteria, then we don't put the average human who might not say they have trauma or identify that way into the bucket the way we do with kids. And what we're talking about with kids is we don't want to traumatize them, is what we're saying. That's what we're saying. Yep. Right? We're proactive. It's very preemptive. It's how do we make this fun? How do we use a stuffed animal to explain what's going to happen when they have an MRI? Do we bring in someone playing a guitar to sing with them during a painful procedure? Do we have suites and business places for their parents in the hospital so they can sleep there and take a shower and get work done and feel a little bit like themselves, Like, that's all done. It's preemptive. In adult medicine, it's like, go to 16 appointments, suck it up. Sorry. And oh, by the way, they're rushing you through.
Or, you want your spouse to sleep in the hospital with you. Well,
sorry. Too bad. Or like what you wrote about and what I experience a lot is the very well-meaning making the patient drink from the fire hose of information and education. This is like what I call the quote-unquote good provider, who's like thinking holistically. They're looking at the person from head to toe. They're finding that root cause. They're sort of like, ooh, this is a puzzle, which is a whole different part of healthcare. Like the one we're describing is a little bit unattuned, right? And now we're talking about overly attuned, where they're seeing this person as a body and a puzzle to solve, and like almost like so skilled and so expert that they can see the intricacies and details, and then they tell them all to you, both as a provider who gets it, but even if you aren't a provider who gets it. Do you really need all that information? How does that feel to receive?
Yeah.
Yeah. Less is more.
Yes.
Could you imagine telling a 15-year-old girl, like, okay, so you came here for your hip, but it's also this. And also I see this in your shoulder. And also this is going on in your neck. And oh, by the way, your foot is doing this weird thing. And we probably need to talk about your pelvic floor. And then, oh yeah, so when you're playing softball, how you swing is wrong. All she wanted was someone to help her with her hip,
Yeah. It's well-intentioned, it
is.
And it is someone who really loves the puzzle and looking
Me too.
Holistically, it's hard to sometimes take a step back.
Well, isn't it interesting
hard to
that
bite your tongue sometimes?
Yeah, I think that's it. I think we're circling to it. So I think it's like, no, we're not saying don't love the puzzle and don't see all the pieces and how they work together. It's what is information for you and what is information for them. We're not saying lie to them. We're not saying don't tell them what they need to know. But I think it's like, when is it about your experience as the provider and when is it about theirs? And how are you deciding how to keep it centered on theirs?
It almost reminds me of like, start with a little bit of information, see how they consume it. And then if they keep asking more questions, you can give them more, but just start with a little bit and see how it goes,
Discernment. There's discernment there.
It kind of reminds me a little bit, it's not the same, but a little bit of like doing a PT exam, right? Like, or I think of like special tests, right? Like if someone has a shoulder that is irritated or like a shoulder impingement, you're not going to go do every single special test in the, you're just going to make them pissed.
It's gonna hurt. Right. I know.
Cram in that shoulder. And so sometimes less is more. Like choose one, or maybe don't do a special test in that situation. And I don't know, like start with less. And then if you need to go more, you can.
I think of the phrase, do no harm.
Yeah. And from a this is like my psychology background a little bit, like from a psychological, we're not psychologists as PTs, but we shouldn't be doing psychological harm either.
Totally. Well, you're still responsible to the sentient human in front of you. It's still an emotional experience. Yeah. Yeah. If you're not attuned to the person's emotions, what are we doing? You know, just bringing it back to the people in your upbringing who weren't, they meant well in praising you for making good grades. There was no ill will there, but there was this assumption that your emotions didn't need to be attuned to because that wasn't, I don't know, they just didn't have a seat at the table. And I think there's a big assumption in physical therapy, in physical medicine, that, well, that's not my lane. I don't do therapy. And we were taught, actually, that's not your lane. You need to know how to talk to this person, but at the same time, like, don't get too into their emotions because then you're out of your scope. And that is just so interesting to me because with kids, we're expected to do it.
That's a great point. Like you have to know child development.
You have to go there.
Yeah.
Because that kid doesn't hide their emotions. Thank God kids don't hide their emotions. And they're crying and kicking and screaming or swearing at you, depending how old they are or not. 4-year-olds might know that word.
Looking at their phone
or
and not paying attention.
Side-eyeing you, not paying attention, getting sassy. They hate you. Like, it's absolutely a psychological experience. Sometimes it's psychological warfare on their part, you know? Like, if you don't have therapeutic skills, not going to work. And then we get to adults and we're like, oh, you're crying. Okay, here's a tissue. Here, let's help you clean that up so we can actually get our job done today.
That's so interesting.
Or maybe you need therapy because you're crying.
It's so interesting because, yeah, like what you just said about like adults, like, okay, well, we still have to do something that I can bill for, right? But in pediatrics, if it's an entire session with a 3-year-old and we get one thing done,
it counts.
And that's therapeutic. There's no harm there.
Yeah.
So interesting.
Do no harm. It includes emotional harm. It's so humbling though, right? I mean, I didn't do this right as a provider. Absolutely not all the time. I'm sure there's countless people who I was like, oh, we got a job to get done here, you know? But I'm with you that I felt so drawn to kids. I mean, now I work with adults, but it's all emotional, everything I do. But like, I felt so drawn to kids because that part of me got to be real. That was attuned. And I loved it. I loved having a child or a teen come in who was so locked in their shell. And like, it wasn't about me. It was like, how can I help you feel safe and comfortable and like you belong here? Because I'm here for you. This is for you. It's not for me.
100%.
Yeah. May adult medicine learn more from pediatrics.
Which is so interesting because it's almost like in the research world, it's opposite, right? Like we learn adult and then peds is always playing catch up.
It's an afterthought. Mm-hmm. Yeah. Well, it's the adult medicine is the lens that peds is sort of reflected back on, but it's really its own world.
Yeah.
It's a whole lifetime in 18 to 25 years. Yeah. Whole developmental timeline. Yeah. How do you feel like either your experience in peds was helped shape your experience in motherhoods, or how has motherhood helped shape your viewpoint into pediatrics?
Yeah.
Or adolescents even.
Yeah.
Yeah.
I think both, but I think my experience in peds as a clinician and just working with kids from high school on has allowed me, like, I understand, and even like my college minor was child and adolescent mental health studies. So like I've always kind of been drawn. Was it really?
Same.
And like, so I love child development. I love just how kids grow. So I think I have that understanding and can understand when my 3-year-old's having big emotions where I ask her not to kick something, that she's not defying me by kicking. Like her body is just doing, like where she is developmentally, I can appreciate as a parent. And I'm not perfect by any stretch of the imagination. But it
doesn't make it any less hard.
Yeah. But I can often bring the logic to it and be like, okay, she's here developmentally. This is where, we are, and this is why. So I think it's helped in that sense. I think as a clinician, being a mother, and I'm still learning it, but I have had to find a whole load of patience that I never thought I had.
Patience with a CE on the end, not a TS?
Yes. Oh, yes. Uh-huh. Yes. And just being able, and really, I mean, I think motherhood has been the biggest test of letting go of control and just letting go. And I said I wanted to do it this way and I wanted it to go this way, and it's not. And I think patients are this way, patients with a T. But even my own kids, I'm like, you are your own person, and I'm guiding you, and I'm your mother, but I can't control you as a person. Like, you have your own thoughts, your own desires, your own wishes, your own, and I need to like foster that, but I can't control you.
Yeah.
And it's
No better
hard
gift.
when we want control over things and we want things to go a certain way. And I'm learning.
I feel like there's just bringing it back to safety, right? There are certain things as a mother where it is a hard line, right? Where you will not be running into the street. We will not be unbuckling seatbelts, Like, it's not that you're controlling them. It's just you're doing it my way. You're doing what I say. And then it's like what you're saying is, but it's also safe and it also does no harm to allow them to self-express, to allow them to explore their desires and
You want
wishes.
to wear your princess dress with butterfly wings and purses into the store? Okay.
You go, girl. Yep. Yep.
Yeah, I think that's been the learning point as a parent, is what is important to stay true to, and like and what's okay to let go of, and what's okay to just be like, you know what, this doesn't matter as much as I think it does.
Gosh, what a gift to them and you. You know what I mean? Like your own parenting of yourself,
Yeah.
Does it feel like that gets to be extended to yourself, or is that also still a work in progress?
I'm learning more about myself than
Yeah.
Oh yeah.
Yeah. Okay. I love that. And I have a little segue question, which is, now how does that extend towards your career? Because I know you're shifting directions.
Yeah.
How does the desire for safety and belonging, but also letting go and being more authentic, and what did we say? Exploring new things, allowing change.
Still figuring this out, Julie. I sometimes say, like, I don't know what I'm doing.
I say that every day.
Right?
Every day.
But I think that's part of it, right? Is being okay with not knowing. Like, I think I'm learning, like, it's okay that I don't know, and it's okay that I'm exploring, because that's where something's going to come out of. And yeah, I think the biggest realization I had was, as my girls get older, the patient population that I treat, young adolescent or, middle school, high school athletes, the only time that I'm going to see them is after school.
Mm-hmm.
And as my kids get older and are in school, and even when they're not doing activities, that is the only time I will have with them. And so I'm kind of feeling this pull of, I want to have time with them, but I also want to do things with my career as a professional. And so where does that and so I teach as well. And so I think the more I do that, the more I love patient care, but I also really, really, really love teaching. And I've kind of had this realization of, a student had come up and was just asking me about starting injury prevention programs for a gymnastics gym. Like, she was a gymnast. And I had this realization of, if my passion for that can be put on other students, like, how much more good, like, they can do so much more than I can do by myself. And I think I just got so excited about that, and just how, anyway, just the education piece and spreading that passion to other people. So that's kind of where I'm focusing. And even from a clinician standpoint, trying to do like more in the education world, as opposed to I'm trying to figure, I've always been super into the idea of injury prevention and helping before things start. The hard thing is, prevention never sells. People don't care about prevention until it happens. So just trying to find other avenues around that isn't necessarily prevention, but that works within systems that are already in place.
Prevention does not sell anywhere. No. For good reason, though, because we're so present and in the moment that thank God we're not all like,
100%.
We're all anxious all the time and worried about things going wrong. That's not what I'm saying, but it's sort of like, you're not so hyper vigilant about something going wrong at any given moment that you miss the moment.
Right.
And then it happens. And then you're like, shoot, I wish I'd known. Right.
But I also think education is so powerful too, of just being aware of something and then knowing what to do if it does happen.
Yeah. I feel like it's just bringing it back to that safety piece. It's like, we can't control the future, but you can set yourself up for success to make educated guesses and hypothesis and hopefully make really value-driven decisions that maybe don't prevent, but lessen the impact of something that wasn't preventable in the first place. Yeah.
But yeah,
I
so
feel like youth sports injuries, an ACL is going to tear. It's like there's good data, and at the same time, the circumstances are there. It's no matter what you do, no matter how much
contact ACL.
Exactly. That's just going to happen. Yeah. Contact concussion, it's going to happen. But at the same time, there's lots of ways to set up kids for success to either lessen the percentage risk of it or eliminate it altogether.
Right. Or I think too, like to your point, the psychological part, if you're fearful of it before it happens, the outcomes are going to be worse
it's probably going to happen.
Right.
You're right. Or
when it does happen,
the recovery.
You're gonna be more fearful around it and not have as much of a positive outlook on it.
Yeah, because you lose trust. You're like, well, I knew that was going to happen. And then you don't trust yourself or your body. Yeah. That's hard.
But yeah, so I'm shifting into more the education, like harnessing that education piece and kind of letting go of that one-on-one patient care for now. And
how beautiful, because there's such a ripple effect with that. It's like you said, you can impact more clinicians and therefore more patients or more people in the community, and while also feeding yourself on what you love to teach and what you want to be doing in your life.
Yeah.
And so you have a ripple effect inward on yourself and your family too. Inward and outward. To use a water analogy.
Yeah. Watering the garden.
A swimmer. Watering the garden. I was thinking more swimming, but also watering the garden. The global garden and also the inner garden. See guys, in pediatrics, we use metaphors all day. All day. It's kind of the best.
All day, every day.
Okay. So what if someone's kind of sort of considering making this type of shift, maybe not this exact shift, but they're like, ooh, I kind of want to listen to my heart and follow this trail, even though it's uncertain, it's scary, and I'm not sure if it's going to work, and leave the more traditional path I've been on, because you've done that 16 billion times now. Mm-hmm. Even though you hate change. Just keeping it with career, but not losing the anchor of you're doing this because you figured out what's valuable to you and your family. What would you tell someone? What would you tell you who is on the brink of this decision a couple months ago or whatever it was?
I think kind of two things. You're allowed to feel what you feel, right? Like you can feel what you feel and sit with those emotions. It's okay. But two, there can be so many great things that come out of what's to come. I think back to my experience on acute care, and I tell students this all the time. My experience as in acute care made me a better ortho clinician. It just made me a better clinician in general. And I don't think it's necessarily acute. I think it's just doing something different, using a different part of your brain, being thrown into a different situation. And almost I had to take the back seat of I know nothing. I almost asking for help and being mentored again. And and just the opportunities that have come and the people I've met. And even when we first moved away from Los Angeles, starting my own practice, I didn't know what the heck I was doing. Right. And that's a whole learning process. And, there's ups and downs, and it's okay to feel what you feel, but leaning into the wonder, going back to kids, the wonder of what could be if I do it.
You're allowed to feel what you feel. Man, high school Kari needed that.
Oh, yeah. Still need that sometimes.
And change is scary. You'll feel out of control, but there's a wonder of exploring new things. Because what could it be?
Yeah.
So Disney of you.
Yeah,
The Disneyland mentality.
There might be some inspiration from Disney deep in my roots.
I mean, I don't know that there's much better inspiration. I don't know. There might be some anti-Disney people out there listening, but I agree. It's pretty awesome. All right. Speaking of fun and playful, we now have a lightning round set of questions. These are fun. Your job is to give me what comes first. Go with your gut. All right. You ready?
Yep. I'm ready.
Number 1, if you could be any animal other than a human, what would it be and why?
Sea otter.
Yeah. Right answer. That's the right answer. All other animals are incorrect.
They've always been my favorite animal, but they are they just look like they're having so much fun all the time. And I just want to be able to swim like that.
Same. That's also my pick.
Is it really?
Yeah. That's why I said it's the right answer. There are dogs in the water.
Yes. A golden retriever in the water. Yeah.
Golden retriever in the water. Yeah. Doesn't get any better.
And they hold hands when they sleep. They do.
I know. If you could get a beverage with two people, dead or alive, who are they and why?
Gosh, there's so many. And it depends on the day. I don't know, Julie, this is hard. Dead or alive? Okay, I'm going to do two that are just like the first that come to mind. Michelle Obama and Christina Cook, who was just on the Artemis mission. Yeah.
Yes.
Also, the two of them together might be really fun.
I'm coming.
Okay.
Tell me when it's going to be. I will be there. Yes, truly. To the moon and back.
Yeah.
Literally.
Yeah.
So many questions.
Yes.
Oh, yeah. Okay. Michelle and Christina, we're going to need to have a conversation.
If you're listening.
The four of us. Yeah. Just
drinks
saying.
are on me.
Yeah.
I will pay.
Yeah. All right. Next question. Does pineapple belong on pizza?
Yes, 100%.
No question.
My favorite pizza is actually, it's bizarre. I don't like ham with pineapple, but pepperoni with pineapple.
Ooh, good combo.
Yeah.
Someone who got married in Kauai.
Yes.
This seems
Yes.
appropriate of an answer. Yeah. Okay. I'm a fly on the wall on an average Friday night at your house. What do I see go?
Gosh. Currently?
Yeah, currently. Mm-hmm.
Before the kids are in bed or after the kids are in bed?
Both.
Well, putting kids to bed, but we try to have fun at bedtime. My husband is much better at it than I am. I kind of sometimes I'm like, all right, come on, like we got to go. We got to do this, do this. And he's much more like, let's wrestle. Like, let's just take 10 minutes and wrestle and just
get it out of your system.
Get it out of the system. He can be the fun one, which is good. And then after, I think honestly, I'm like being real and honest. My husband and I both are kind of in a season of just where we're working when the kids go to bed.
Yeah.
And that's just kind of the season we're in. Our desks are right next to each other in his office.
I love this.
But a lot of times we're working together. I might be laying on the couch. He might go to bed a little earlier, but a lot of times that's kind of when our work gets done after the kids go to bed.
Yeah. Sometimes it's when you can be the most creative.
And I'm the person who needs a big chunk of time to do something. I don't do well with, okay, I have 10 minutes here or even an hour. I have an hour here. I can get a bunch of, like, I can't. I need 4-hour chunks.
Yes. Don't fence you in.
Yeah.
Don't fence that in.
Yeah.
Give it space to breathe.
Yeah.
I love it. I hear you on that. So relatable. All right. Last question. What's a hidden pleasure or obsession of yours that some people may find surprising, weird, quirky, or questionable?
Gosh.
We already said Disney.
I know. Hidden passion. No.
Hobby.
I know. Well,
like what rabbit holes do you go down on the internet
that aren't parenting related?
I could name one for you. You already said it.
What?
NASA, Artemis, moon.
Yes. Oh yeah. I'm
everything
with,
space.
Yes. Oh yeah.
Space
I laugh.
kid.
My Instagram search is all just NASA. Yeah, I
Me
love. Too. Yeah, space right now is big, and it's big in our household. The girls are loving it too.
Yeah.
But I'm very slow at this, but I started trying to teach myself how to embroider.
Cool.
Kind of a fun. I haven't done it in a while, but that's like a fun thing I started. Yeah. I also
do you use a sewing machine or is it like by
hand?
hand?
Just hand.
Okay.
Yeah. Just learning the different types of stitches and.
Wow.
I also, this is kind of, people think I'm crazy. The books I love to read are nonfiction books. A lot of my friends, I feel like, are like, so some of we do like a book club, and I'm not allowed to recommend a ton of nonfiction. The first book that I recommended, it wasn't nonfiction, actually, it was fiction. But I'm trying to force myself to branch out into fiction but I love nonfiction.
What do you love about it?
That's a great question. I think some of it's the human experience. That's, and you have the human experience in fiction. I cry in fiction books all the time, but I think there's something different about someone's truly lived experience.
It's real.
And the rawness and the realness. And
said like someone whose minor was developmental psychology and mental health.
Yeah.
And
loves to learn.
Yeah. And loves people.
Yeah.
Mm-hmm. Yeah. That sounds right.
Yeah. Checks out.
You just want the real side of it.
Yeah.
You're like, give me a real story.
Yeah.
Cool. Yeah. You like memoir.
Yes. Yeah.
Yeah. Memoir is fiction, but it's someone's real life.
Yes.
Yeah.
Yep.
Basically.
Yep.
Storytelling.
Mm-hmm.
Cool. I love it. Okay. Well, we could and would, if we had all the time in the world, talk all day. Is there anything coming up for you? Any place you want us to find you? Anything you want me to put in the show notes for people to click on? Yeah, I'm currently things are brewing that not quite announcing yet, but just in terms of education for clinicians, especially those I
wrote this out the other day, but I'm like, yeah, no, like this is kind of my mission, is to really make people feel more comfortable talking about the pelvic floor, especially in teens. I was talking to a colleague after CSM of like how it's a systemic thing and it's our culture, but especially around teenagers, like it's just awkward and people don't want to talk about it. And so it starts, I think, with us in for a lot of reasons of just starting to normalize the conversation and getting more comfortable ourselves about talking about it and asking questions about it. So if you're interested in anything related to adolescent pelvic health, or you're just working with young kids, stay tuned. I'm hoping to have some more kind of educational stuff coming out.
Yes.
Yeah. And
Also,
you can follow
your
my
Facebook
Instagram.
group.
Oh, yes, that's right. Thank you. Yeah, so I post a lot. I'm starting to post a lot more on my Instagram. And then I created it's called the Youth Athlete Huddle, and it's a Facebook group. It's free. And the idea is really to connect other providers who either are already super passionate about working with that population, are, experts in that area, or those who maybe treat developmental peds or maybe treat adults, but also get the occasional like youth athlete or teenage athlete, and just creating a community to ask questions and brainstorm, get exercise ideas, or, just really creating community around this population.
We got to stick together.
Yes. Yeah.
It's a exciting little world for sure, but hopefully it can grow.
Yes. Yeah. And I think the catalyst for all of this is just realizing there's a lot in the sports world on adult athletes and elite athletes, professional athletes. And then there's a lot in the peds world on more developmental, and the youth athlete kind of gets, and even in the pelvic health world, like the adolescent patient is just caught in the middle of these two worlds. And there's information out there, and this is not throwing shade at anyone or, it's not a negative, but a lot of the stuff out there is the same stuff, all that, growth plate injuries, and which is great. We have to know about it, but there's so much more that we don't.
Yeah. They're not big kids and they're not little adults. They're their own world.
They are.
And I love that in various parts of the world and in the country, pediatrics is kind of getting its own adolescent medicine specialty, but it's super grassroots and it's very fringe, unfortunately, but also fortunately. And the ripple effect can only happen if someone has the courage to say, actually, I think we need to talk about this more as its own thing. So I'm glad you are.
Thank you.
Yeah.
Thanks for inspiring me always.
Anytime. You're taking the ripple effect I took, and I was like, I don't want to do that anymore. Here you go. Here you go. Please take it. Someone pick it up, please. So I'm super excited you are. Awesome. Well, we will make sure to get all of this out there and get the word out, and y'all get excited about youth athletes because they're the best.
They are.
Okay.
They are.
And adolescent girls, it does not have to be awkward to talk about pelvic health.
Nope.
Well, let me say that differently. It's going to be awkward.
Yes.
You get to feel your feelings.
And I always say,
and they get to feel theirs.
If you are confident about it, they will feel safe.
That's right.
Going back to, they will feel safe and it will be less awkward.
They still might be weird about it at first, but they're going to want to come back because they'll be curious. Yep. Yeah, that's true. So true. All right, madam. Well, thank you for being here.
Thank you so much.